Hi, my name is Chester. Today I'm going to be performing a focused cardiovascular and peripheral vascular assessment. My patient is Mitch. He's a 35-year-old male. We've already done his history, and I'm going to go in the room and introduce myself, get his consent for the assessment. Knock, knock, knock.
Come in.
Good afternoon. My name is Chester.
Hi, Chester.
Nice to see you again, Mitch. How are you feeling today?
Great.
Great. I'm just going to do a little cardiovascular assessment today. I'm going to feel your pulses in your neck and listen to your heart sounds. Check your feet out if that's okay.
Okay.
Okay, great. Initial assessment, I'm going to inspect. Looking at his chest movements, I don't see any abnormal pulsations. His breathing is even, unlabored, no signs and symptoms of distress. I'm looking, you can see his legs. I don't see any apparent edema upon initial assessment. I'm just getting an overall look here. But I'll palpate later for that to make sure there's no edema. Mitch, first of all, I'm going to start off, I'm just going to feel at your neck. I'm going to feel your carotid pulses. I'm going to do that one at a time on each side. You never want to let anybody palpate both your pulses and your carotid pulses because it can actually cut off blood flow to your brain, and that wouldn't be good. And I'm going to avoid palpating the high in the carotid sinus because that can cause a vagal effect too, which causes heart rate and blood pressure to drop. And this is especially true with the older patients. I'm going to start with the right side, and I'm going to go lower in the neck, and it's going to be medial to the mediastinum muscle here. It's just a light palpation. You don't really want to massage it. 2+, that's a normal pulse pressure. That's got a rapid, smooth, upbeat. Same thing bilaterally, 2+ on the left carotid as well. I don't see any abnormal pulsations either. I'm going to go ahead and feel your chest for any kind of abnormal movements. You've been having any chest pain or discomfort? Okay, good. I'm going to use the palmar surface of my forefingers on each hand, and I'm just going to feel across the precordium here. And I'm looking for heaves, thrills, or any kind of abnormal impulses that make my hand rise. And no heaves, thrills, or abnormal impulses felt. Now I'm going to go ahead and feel his apex pulse, or they used to call it the point of maximum impulse, but that's going to be located along the mid-clavicular line at the 5th intercostal. So I'm going to count down. 2, 3, 4, 5. And it's usually normal chest configuration. It's in alignment with the nipple. But for women who have large breasts or drooping breasts, you would ask them to, you would displace it and ask them to hold their breasts so you can actually find this. So I'm going to feel around. And sometimes people, you can't feel their PMI or their apical pulse because they have barrel chest from COPD, and if they have any kind of cardiomegaly or left ventricular hypertrophy, it will actually be displaced to the left even more. And I found Mitch's right here under his nipple. I'm going to check his rate too. This is your most accurate pulse rate. You want to count for a full minute, of course. Alright, my minute's up. You're at 70 right now. Okay. I'm going to go ahead and listen to heart sounds. I'm going to clean my stethoscope. And I have a cardiology digital stethoscope where I can automatically adjust the bell and the diaphragm, or have them both on at the same time. So. Okay, the first heart sound I'm going to listen to is the aortic, and that is located at the second intercostal space on the right sternal border. In our heart sounds, they typically make a lub-dub for S1 and S2 for normal heart sounds, and at the aortic you can hear S2 louder than S1. Okay, I'm going to move over to our pulmonic heart sound, which is located along the left sternal border at the second intercostal space. And in this position, S2 is still louder than S1. And while I'm listening, I'm also listening for any kind of murmurs or anything abnormal with the heart sounds. And Mitch, just because I'm listening, I'm taking my time, that doesn't mean anything's wrong, so don't feel worried. Okay, now I'm going to move down to the third and the fourth and the fifth intercostal space, and along the sternal border, that's where our tricuspid sound is. And S1 should become more prominent at this position. And then I'm going to move over to the mitral valve, which is also where our apex is when we are palpating. And this is where S1 will be the loudest. And my nifty little digital stethoscope here tells me that his heart rate is 71 now. And if I want to feel too, I'm going to feel your neck, Mitch, and his carotid to see if it's matching. And it is, and I can feel a radial too. I can feel the other radial as well. Alright, great. Now I'm going to listen for bruits or any type of evidence that would give us there's occlusion in his carotids. And I'm going to do that in 3 spaces on each side. And just a word of caution, just because you don't hear a bruit doesn't mean there's occlusion, because at a certain point when an artery is so occluded, you won't hear a bruit anymore. So you can't rule out that there's not a bruit present in the presence of other clinical signs and symptoms. So my first position I'm going to listen is going to be the jawline, and you can just keep your head straight there. So at the angle of the jaw, I don't hear any type of bruits, which are like a swishing or blowing sound that is indicative of blood turbulence caused by occlusion. And then I'm going to do the mid-cervical. Now Mitch, if you could just take a deep breath for me, exhale it out, and hold it. And then I'm going to do the base of the neck. Keep holding it. Okay, you can breathe normally for me. And I asked them to take a breath and exhale and hold it so we can just eliminate the tracheal breath sounds so I can get a better idea of what I'm listening to. And That's an important part of assessment, is tuning out any kind of ambient noises and controlling your environment. Okay, same thing on the other side. If you could take the deep breath, exhale, and then when you're done, hold it, and I'm going to listen. The angle of the jaw first. Mid-cervical. And the base of the neck. Okay, you can breathe for me. Now I'm going to go ahead and check out your legs, palpate some of your pulses. When I'm inspecting his peripheral vascular system, I can see that his legs have hair and they're not shiny. His toes have hair too, and that's a first indication that you've got good blood flow to the legs and feet. When people have compromised blood flow, they tend to lose the hair and their legs become very shiny. They can be pale and cool. There's several symptoms. I'm looking at them and I'm going to go ahead and feel them. They're bilaterally evenly warm. I don't see any apparent edema. I'm going to go ahead and give his ankles and feet a little squeeze, see if there's any pitting edema. And that's usually, pitting edema is graded on a scale of 1 to 4. 1 is you push in and there's a little indentation and it goes away quickly, and it progressively gets worse to at 4. When you got a 4 pitting edema, then you're looking at probably it not returning back to the begin stage for about 30 seconds usually. It's a subjective scale. There's no definitive scale or system on how to actually measure the pitting, but Mitch does not have any pitting edema. You can test his capillary refill. It's less than 1 second on each foot. His nails do not appear to have any type of ridges or thick buildup, which is another sign of diminished blood flow. I'm going to go ahead and palpate his pedal pulses. I'm doing the dorsalis, pedis dorsalis, which is the anterior aspect of the foot here. 2+, good pulse, and then I'm going to do the posterior tibialis, which is located along the back side of the malleolus, just along that ridge in between the malleolus and the Achilles tendon. 2+ on those as well. And now I'm going to palpate his popliteal pulse. And for this one, I would ask him to bend his leg a little bit. And I'm going to cut both of my hands back into the popliteal fossa, which is in the back of the knee. And I'll use at least 3 fingers on each hand. And you really kind of got to dig in there and slowly move your fingers out. It can be a difficult one for people to find. Okay, and I found it. 2+ on this side. Do the same thing with the other. And if you're having a hard time finding the pulse, you can actually ask the person to lie on their stomach, and you can try to palpate it from that position. Okay. 2+, good. And that concludes our focus assessment. Thank you very much for participating, Mitch.
You're welcome.